Kia ora everyone, this is almost everything you'll need to know about the nerves of the lower limb part 2. We'll be looking at the lumbar and sacral plexuses, and we'll start with the lumbar plexus. The lumbar plexus is derived from the nerve roots L1 to L5, and we've already seen that the two large motor nerves of the plexus are derived from the L2, L3 and L4 roots, and these are of course the femoral nerve and the obturator nerve. Apart from these large motor nerves, the remainder of the lumbar plexus forms a chain of cutaneous nerves around the proximal lower limb. So basically from the upper gluteal region along the iliac crest and then following the inguinal ligament towards the pubic symphysis. So roughly where Fergie likes to wear her scarf. Or if you prefer, where young Axel likes to wear his plaid shirt. If we remove the motor branches from our diagram, we'll be left with the cutaneous branches only, and also the lumbosacral trunk. We'll have a look at these schematically first, and then return to the picture here to look at their distribution. We'll start with T12, which is the last thoracic nerve, which is the subcostal nerve, and then our roots of the lumbar plexus. The L1 nerve divides into two branches, both of which have L1 in the name, sort of. They are the Iliohypogastric Nerve, and I'll just change the colour here, the Ilio Inguinal Nerve. L1 and L2 combine to form the Genitoe Femoral Nerve, which then divides into a genital branch and a femoral branch. L2 and L3 combine to form the large lateral cutaneous nerve of the thigh, or lateral femoral cutaneous nerve. The motor nerves were derived from L2, 3 and 4, the femoral nerve and the obturator nerve, and L4 and 5 combined to form the lumbosacral trunk, which is the contribution from the lumbar plexus to the sacral plexus, so not a cutaneous nerve. So returning to our image, this is the T12 or subcostal nerve. It's not really a nerve of the lower limb because its cutaneous distribution is the suprapubic area, but it does have this lateral branch which projects down over the most lateral part of the gluteal region, or just over the hip, which we can see if we turn our image and add some muscles. This guy here, so supplies this area of skin, which is about where a wayfaring gunslinger would wear his pistol holster here, or where once again Fergie would wear her purse. By the way, what's going on with these nails? Also, nice palmaris longus tendon. The iliohypogastric nerve from L1 curls around the most proximal part of the lower limb. It also has a lateral branch that projects down over the gluteal region. This is it here, and supplies this area of skin just behind that of the subcostal nerve. This is about the region where you'd put your hand to fish something out of your hip pocket, like so. The ilio-inguinal nerve carries on longer than is shown here and projects down into the inguinal region, true to its name, to supply skin in the groin area. This is the nerve that is stimulated when trying to elicit a cremasteric reflex, so the most medial part of the thigh. The genitoe femoral nerve from L1 and L2 takes a more direct route, and this is its femoral branch, which projects essentially over the femoral triangle, supplying this area of skin. And the genital branch supplies either the anterior lateral part of the scrotum or the labia majora, so not in the lower limb, so we can forget that. Then the L2 and 3 combination to form the lateral cutaneous nerve of the thigh, which has an extensive distribution all down the lateral part of the thigh to the knee. So all together now, we can see how these nerves provide sensation to the proximal part of the lower limb. The lumbosacral trunk is these contributions from L4 and 5, which will head off towards the sacral plexus, and we'll catch up with them very soon. In fact, sooner than you think, because this is the sacral plexus here, and we can see that it's mostly concerned with forming the sciatic nerve, though there are several other smaller branches. The contributions from L4-5, the lumbosacral trunk, these are the posterior divisions, and they're joined by the posterior divisions of the S1, S2, and sometimes S3 nerve roots to form what will become the common fibular nerve. The anterior divisions of those same nerve roots, L4, 5, S1, 2, and 3, will form the tibial nerve, and the tibial and common fibular nerves travel together in the thigh as the sciatic nerve. I'll talk about the significance of the anterior and posterior divisions soon, but you don't really need to know much about that. There are several other nerves formed in the sacral plexus, most significantly the posterior femoral cutaneous nerve, which we've met before. The last nerve to be formed is the pudendal nerve. It's a nerve of the pudendum or perineum and taint in the lower limb, so although we acknowledge its presence, it's really just a signpost for us to say that that's the end of the sacral plexus. There are several other smaller nerves that are formed in the sacral plexus, and to see how they're formed, we'll look at another schematic representation. Let me show you more method. L4 and 5, the lumbosacral trunks, then S1, 2, 3, and 4 will be our roots of the sacral plexus. If we just connect all of these roots two at a time, and then connect the connections, we get the schematic outline of the sacral plexus. There are 4 end points, excluding the sciatic, the most inferior of which is the pudendal nerve, which, as I said, we can name and then ignore. Most superiorly is the superior gluteal, so that's handy. Then is the inferior gluteal, and the last before the pudendal is the posterior cutaneous nerve of the thigh, or posterior femoral cutaneous nerve, which we've seen before. In fact, we've seen all of these nerves before. Now we can see how their nerve roots are derived. So, for example, the superior gluteal nerve is derived from L4, L5, and S1. The posterior cutaneous nerve of the thigh is derived from S1, S2, and S3. The only other thing that we need to do is to add in a few extra nerves. The superior gluteal nerve is the posterior divisions of L4, L5, and S1. The anterior divisions form the nerve 2 quadratus femoris and inferior gemellus, which we have seen before. The L5, S1, S2 anterior nerve roots form the nerve 2 obturator internus and superior gemellus. Now I remember these as complementary sets, so there's a superior named nerve and an inferior named nerve in each of the sets, if you like. So inferior gluteal and nerve 2, the superior gemellus. So as long as you remember how the quadratus femoris and inferior gemellus share a nerve, and the obturator internus and superior gemellus share a nerve, and then you can just match those up with the inferior and superior gluteal nerves as complementary sets. I hope that makes sense. Once you get to grips with it, it's certainly a lot simpler than remembering all the details from this table. So just to make the point, if we choose the inferior gluteal nerve, which is L5, S2, and then recall that its complementary set nerve will be the nerve to the superior gemellus and obturator internus, that will be also L5, S2. So it works out. The next big question is, what's with all these anterior and posterior divisions of the motor nerves? Just by the way, this is incorrect. That should read anterior divisions, growl. And also, why is the femoral nerve, the nerve on the anterior part of the thigh, a posterior division, and the tibial nerve, which is a nerve of the posterior leg, an anterior division? It doesn't seem to make a lot of sense. I don't know the answer to that, but I can tell you a story I made up that might at least help you come to terms with it. If we imagine a primordial creature, vertebrate, in axial section, swimming in the primordial ocean, it has a spinal cord dorsally and a body cavity ventrally, and it has the good fortune to develop some limbs that stick out, but because it's kind of a basic creature at this stage, all it can do with the limbs is either move them dorsally or posteriorly away from the ventral midline, which is here, or it can move ventrally or anteriorly, I suppose, towards the ventral midline. And the nerves that innervate those muscles are either posterior or dorsal divisions, or ventral or anterior divisions. So it's a very simple body plan. If we turn our creature around and look at it lengthwise, this is the body. We'll give it a tail for propulsion, and it can have 4 limbs this time. But again, the limbs are controlled by nerves that either are on this side, that tend to move the limb this way, so outwards, or inwards. Now if we chop off its tail and spin the whole thing round so that this head end is up and the tail end is down, and we'll get it to grow a head, posterior divisions and anterior divisions, and all this kind of coalesces into a central nervous system with some photoreceptors here. And you can see that what we've developed here is a creature like this, which has anterior divisions for controlling these ventral surfaces and posterior divisions for controlling the outside surfaces, if you like. So this is going to be the femoral nerve. This is going to be the deep fibula, really. The superficial fibula will be facing the concrete. While we're at it, this will be radial, which you may recall was merely the combined posterior divisions of the 3 trunks of the brachial plexus. These will be tibial nerve, and this will be obturator nerve. And this representation is accurate for the anterior and posterior divisions that contribute to these peripheral nerves. So I hope that helps. Hopefully we've just got time now to look at the remaining cutaneous nerves of the lower limb. We'll recall the posterior cutaneous nerve of the thigh here had these inferior cluneal branches to supply the skin of the lower buttock. The middle cluneal nerves here and the superior cluneal nerves are just lateral branches of the posterior rami of the spinal nerves, which are the nerves that supply the skin in the midline of the back. So they're just extensions of those nerves. Again, if you're having trouble remembering that cluneal means buttock, recall once more George Clooney's bum, which again made headlines when Sandra Bullock, here they are together, claimed that George's butt was used to double for hers in a movie scene because, as she said, George is a lot less hairy down there, baby bottom, versus what I've got down there, which is a chair pet. If you're like me, you had to look up what chair pet was, so I'll save you the trouble. Boom. And here she is delivering the line, just incredible. So buttock, Clooney, cluneal, hopefully now you'll never forget it. Anyway, back on track, quick revision. Lateral cutaneous nerve of the thigh, just in the picture here. Lateral branch of subcostal nerve. Iliohypogastric nerve, superior cluneal nerves, middle cluneal nerves, inferior cluneal nerves, and posterior cutaneous nerve of the thigh. Lateral femoral cutaneous nerve, lateral cutaneous nerve of the thigh. Femoral branch of genitofemoral nerve. Ilio-inguinal nerve. Cutaneous branches of the femoral nerve. And cutaneous branch of the obturator nerve. Saphenous nerve, the distal cutaneous branch of the femoral nerve. superficial fibular nerve and deep fibular nerve. Up here is a cutaneous branch of the common fibular nerve. We'll just work our way around the leg here. More posteriorly, there is a nerve called the Sural Nerve, which is a combination of collateral branches from the tibial and common fibular nerves. They give off communicating branches to each other to form this Sural Nerve, which is a cutaneous nerve of the posterior and lateral part of the inferior half of the leg, and also the lateral part of the foot. It's a bit of a mouthful. This again would just be common fibular nerve. Last one. And last of all, you may recall that the skin of the sole of the foot is entirely supplied by the terminal branches of the tibial nerve, which are the medial and lateral plantar nerves. So that's almost all you need to know about the nerves of the lower limb. I hope that makes some things clear or clearer. Next time we'll look at the vessels of the lower limb, which hopefully will be a briefer review. Until then, ka kite.